this afternoon to talk about GP CPCS. I'm joined by my colleagues from the GP CPCS working group, Beverly Eastman from Primary Care Board and Esther Burrow, who works for GMLPC. My name's Alison Scowcroft and I work for CHL. We're all part of the GP CPCS working group. Next slide, please. So just a little bit of housekeeping. Obviously, this is a recording, so this is not as relevant, but obviously we want to try and make sure there's as little interference as possible. So if people can make sure that they're on mute, and if there are any questions, you can add those into the chat box to the right-hand side of the screen. Thank you. Next slide, please. So we've got some objectives for today. Hopefully by the end of this webinar, you will be able to understand the GP referral pathway, understand which patients can be referred and who it is in your team that can make those referrals. We're also going to go through the Greater Manchester protocols and escalation process and hopefully talk about when your practice may be able to go live and start to make referrals. And then also for you to understand how general practice and community pharmacy will work together to make this service really work well. Next slide, please. Next slide, please. Thank you. So we'll just give you an overview of GP CPCS. Hopefully everybody who's watching this training webinar has some kind of background and knows a little bit about it. But just to give you some background, the NHS CPCS is a service that was nationally commissioned and funded, and it began in October 2019. So CPCS stands for Community Pharmacist Consultation Service. And initially, back in October 2019, electronic referrals were made to community pharmacies from NHS 111. Whilst that service commenced back in October 2019, there was also a pilot that was commissioned by NHS England around about the same time to test a referral pathway from general practice. And we did have some pilot sites in Greater Manchester, which was great. We had some in Bury and some in Tameside and Glossop. So we had the opportunity to contribute into the evaluation of that pilot. And NHS England did, as I mentioned, completed that evaluation and the service was agreed to commence then from the 1st of November 2020. So the GP CPCS service is exactly that pathway. It's a referral pathway for general practices to refer patients with a minor illness or a low acuity condition to a community pharmacist. All patients who are referred electronically will have a consultation with the pharmacist where the pharmacist will clinically assess that patient. And only patients who have been electronically referred can be included in this service. We'll go into the referral pathway in a lot more detail in a little while. Next slide, please. So we thought it'd be useful to give you some numbers to support what it is that we're trying to do with GP CPCS. So with the NHS 111 referrals, there were 332,000 referrals made to community pharmacies between October 2019 and June 2020. And they were averaging around 10,500 patients per week. So that's just saying to you that actually community pharmacy is very comfortable with dealing with this type of patient and have significant experience in dealing with these referrals from NHS 111. Indeed, they've been doing them for almost a couple of years now. The other two stats that I wanted to just bring to your attention was particularly around the GP referral pathway. So in the pilot that took place, as I mentioned, in 2019 and 2020, 88% of patients in that pilot were advised or treated by the community pharmacist. So almost 9 out of 10 patients who were referred into community pharmacy by the GP had their issue resolved or addressed completely by the pharmacist. It's also been estimated that around about £20 million could be saved if 6% of all consultations in general practice were transferred to community pharmacy. And that figure of 6% is what's been put together by PSNC, that they agree that that's the percentage of consultations which could be safely transferred to community pharmacy. So hopefully those numbers just provide you with a little bit of reassurance that actually GP CPCS is a good thing for all of us. And next slide, please. So what are the benefits of GP CPCS? Hopefully we're preaching to the converted here. This is all about the patient seeing the right healthcare professional at the right time. It's about creating capacity in general practice. We absolutely don't want patients who have minor illnesses or low acuity conditions taking up GP appointments when actually those GP appointments are much better saved for those patients who can only see a GP for whatever it is that is wrong with them. For patients, they get accessible and professional service from the pharmacist of their choice. And for community pharmacy, it's helping us to demonstrate what our place is within the NHS in terms of managing these types of patients. And we do see that it's building on and enhancing those relationships between all different types of providers within primary care. And ultimately, it does allow cost-effective use of NHS resources to support those patients. So hopefully you can see this is going to help you as a general practice in terms of creating capacity so that you can get on with your business as usual and dealing with all the other workload that we know you have that's escalating at these difficult times. Next slide, please. Okay, so I'm going to go into a little bit of detail about the referral pathway now. There's a couple of slides that are quite busy, so I'll just talk over those and then I'll go into them a little bit more detail following. Next slide, please. Thank you. So the referral pathway starts with a patient requesting support for a minor illness. So as you can see on the left-hand side, that's a call into NHS 111 for the NHS 111 pathway. But for you guys in general practice, it's a phone call or an online request into the practice with a patient who has a minor illness. And the patient then will be streamed and sent to a nominated community pharmacy. As I mentioned, I'll go into that in a little bit more detail in a second. So that referral is sent electronically and the community pharmacy receive that as an electronic message in their farm outcomes system. Next slide, please. So this is a really busy slide that tells you all the things that can happen then once that patient has been referred to the pharmacy. In Greater Manchester for GP CPCS, it is the pharmacy who will contact the patient to follow up that referral. That's something that's been agreed locally. The pharmacist will have a consultation with the patient and there's a number of different outcomes that might take place following that consultation and following the pharmacist's clinical assessment of that patient. The pharmacist will record the consultation in Farm Outcomes, which is the system that we're using in Greater Manchester, and a post-event message will be sent for each consultation to the GP via NHS Mail. Next slide, please. So just going into a little bit more detail now about that referral process for you. So the process begins when the patient contacts the practice to request an appointment for a minor illness. So it might be that the patient makes a phone call, they might send an email, they might fill in a web form that you have on your website, or there might be some other system that you use. We know there's lots of different ones available that different practices are using. But whoever it is in the practice who receives that patient query, a receptionist, a care navigator, whoever it is in your practice who receives those patient queries, what they will do is they will assess those symptoms that the patient is reporting against this list that's on screen here. I call it the red and green list, and we'll make sure that your practices have copies of this to hand. It might be really useful actually to get these printed off and stick them up in people's workstations or have them on the desk handy to refer to. So this list is not comprehensive, it's an overview and there is more information in the service specification. We've got links for those at the end of the webinar today, but this gives you a really good idea of what type of symptoms are appropriate to be sent to the pharmacy and which are not. So everything generally on the left side, which is green, all those symptoms are appropriate to be sent through to the pharmacy. On the right-hand side, we have got some exclusions on the red side, and these are more likely things where symptoms have lasted longer than 2 or 3 weeks, which suggests that it's not really a minor illness or a low acuity condition. If the patient has been experiencing those symptoms for 2 to 3 weeks, then it's probably less likely to be something the pharmacist could resolve over the counter. And there are some other red flag type symptoms there in the red box. So particularly if anybody has any conditions such as diabetes, some of these symptoms would be a little bit more worrying. A gynecological or thrush type symptoms, for example, if somebody's diabetic, would be more of a concern. So if that's the case, then we prefer you keep those patients in general practice. Please don't refer them to community pharmacy, because we want to make sure that patient has a positive experience. But I really recommend that you familiarise yourselves with this symptom list, the green and the red, because the more comfortable and confident you come in making referrals based on this list, then the better patient experience your patients will have once you've sent the referral. There is just a little note there to say that the referral service is only for patients aged over 1 year. That is a requirement in the service specification. So if you are getting any referrals for children and any requests for appointments through for children, please just do double check that they are over 1 year. Okay, so once you've decided that patient is appropriate to be referred to the pharmacy, then we're going to fill in the referral, which is on the next slide, please. Thank you, Esther. So in Greater Manchester, we're really lucky that we've managed to secure funding to pay for a referral tool which sits directly within EMIS for you. If you're not an EMIS practice, there is another tool available which is called Farm Refer, and that's similarly very simple and straightforward for you to use. We'll make sure that the links for both of those are available in the slide deck for you. So we are going to just go through the EMIS solution because that accounts for the majority of practices in Greater Manchester. So the tool is called Patient Access Connect and it's integrated directly into EMIS Web. We've got a video to show you in a second that shows just how simple and straightforward this is to use. And what it does is it actually sucks a lot of the information out of EMIS for you. So all the stuff that's on the left-hand side at the bottom of the screen there, the patient's name, date of birth, gender, for example, all that information is pre-populated into the tool by EMIS. So all you need to do in the practice is to confirm which pharmacy the patient wishes to be referred to, type in that into the referral tool. It will bring up some options and you can select the correct pharmacy. There's a free type box for you just to add some very brief notes about what it is that the patient has, what their symptoms are, and then you just press send. So it's really simple and straightforward to use. So if we go on to the next slide, please. So just before we go into that video, in the EMIS Patient Access Connect tool, there are two different options that are available to you. What we've decided in the project team, the working group for CPCS, is that we don't want to mandate that you use one or the other of these two different options, but we wanted to explain to you what the reasons are for both options, and then as a practice you can decide which one you're going to use. So you can create a referral, so that's the pink button as you can see on the screenshot in the middle. And we suggest that you use this button when you feel that you're quite comfortable and confident that the referral you're making is suitable to be referred to the pharmacy and doesn't require any further triage support. So it might be that actually your more experienced members of staff use create a referral. So that's quite quick and simple for you to use. The assess for a referral option does have some extra questions in there, so it does take a little bit longer to complete. But what it does is include some triage questions which are helping to weed out any red flags. So they're thinking about things like sepsis there, for example, which I know is certainly at the top of lots of people's minds when we're talking about patient symptoms. So assess for referral does take a little bit longer to complete, but it may be something that you suggest that your less experienced members of staff use, or it may be that you decide you want everybody in the practice to use one button or the other. So just wanted to give you that overview of which one which does which, so that you can make a decision in your practice as to which you think is most appropriate for you to use. Either create a referral, which is quite simple and straightforward, or assess for a referral, which includes those additional triage questions. Next slide, please. So this is a video, so we'll just play this for you. It's just quite a short video, about 4 minutes, which shows how the Patient Access Connect tool works. Thanks, Esther.
The Patient Access Patient Signposting app is a new tool integrated into EMIS Web to allow joined-up referrals into Pharm Outcomes as part of the Community Pharmacist Consultation Service, CPCS. To use the Patient Signposting app, log into EMIS Web in the usual way. When you use Find a Patient to select a patient record, or when any of the care record options are opened from the Quick Launch menu and a patient record is selected, the app becomes visible here. The Signposting app is made available at multiple points during the patient's journey so that you can refer a patient easily at any appropriate time. Clicking on Patient Signposting opens up the app in a new window. The patient and GP details appear at the top of this page. Click Create a Referral to begin the referral. All of the patient details will be populated from the information held in EMIS Web. A notes field is available to add any clinical information, such as the presenting symptoms and reason for referral. Click Continue and you will be taken to a page where you can select an appropriate pharmacy to refer to. The patient's home postcode appears in the search box. Click the search button to display a list of the closest pharmacies to the patient's home address, or you can search an alternative location, for example near to the patient's place of work. Select the preferred site and additional information such as their address, a map of their location and opening hours appears. If the patient confirms their selection, click Send a Referral. You will see that the referral has been successfully sent when this confirmation message appears. Patient advisors can access the patient signposting app directly from the appointment book. Patient advisors should click the Assess for Referral button on the Minor Ailment Service to identify patients who can be safely referred through CPCS. A series of triage questions, written and peer-reviewed by GPs, allow the patient advisors to safely identify the appropriate patients for referral. Once the triage questions have been answered and the patient determined as suitable to refer, the pharmacy choice page appears as before. The chosen pharmacy is notified of receipt of a referral into their Pharm Outcomes system in the following ways. The pharmacy will receive an email to inform them that a CPCS referral has been received. If the pharmacy has a Pharm Alarm device installed, it will start to flash. All incoming referrals appear at the top of the services screen in the Outstanding Referrals section. The pharmacist receives details of where the referral has come from and the date it was sent. The patient details appear at the top of the referral form, along with any notes made by the referrer. The pharmacist is then able to complete the referral form. The presenting complaint is recorded, and links to the appropriate NICE clinical knowledge summaries appear to support clinical decision-making. If the patient requires escalation to another service, information on the appropriate pathways appears. If not, a symptom check and any actions taken are recorded. The consultation outcome is then recorded, which may include appropriate advice given, the supply of a medicine by over-the-counter sale or under a local minor ailment service or PGD, or that the patient was signposted or escalated to another service. Incidents such as urgent patient escalations can be reported directly to the CPCS commissioners from within the service using this message box. When the record is saved, a notification is sent back to the referring GP surgery that includes the pharmacist's details, patient details, consultation details and full outcome, and any medicine supplied if this applies.
Brilliant, thank you. So following that video, we're just going to take you through some of the consultation outcomes. But just before we do, just to recap a few of the key points that were raised in that video, the referral is going to be sent to a pharmacy of the patient's choice. So it will auto-populate with their home address, their home postcode, and the pharmacies that are closest to them. But that can be changed to a work address or another family member's address, depending on where they want that to be sent. Once the pharmacy have received the notification of the consultation, the referral through Pharm Outcomes or and via NHS Mail, the pharmacist will have a personal consultation with the patient, either remotely or face-to-face if it's clinically required, and they'll have access to their summary care record or NICE clinical knowledge summary as well. So if they do need to get additional patient information, they can do so. So as stated in the video, there are a number of outcomes that are listed on the screen in those bubbles. So they include advice only, advice on an over-the-counter sale, advice into and a referral into the minor ailment scheme, or there are some possibilities that the referral will need an escalation to another service or for a routine or urgent appointment. So as it said, once the consultation has been completed, the general practice team will receive a notification of the consultation outcome. So this is something that's really great about this service, is it begins with general practice team, it comes to the pharmacy, and then there'll be notification back so you know what the outcome was. So that will be received via an NHS mail address, which will agree with you ahead of your go live. So we will just need you to make sure that is verified so that you are receiving those consultation outcomes when you are actively sending referrals. So we've just got a flow chart here which shows you kind of an overview of the service along with some of the GM agreements, the local agreements we've made to keep it consistent for all pharmacies in Greater Manchester. So the first point is that the referral is sent electronically from the GP to the pharmacy, and the patient is told to wait for contact from the pharmacy team. So this is slightly different to an NHS 111 referral, because in that case, the patient is asked to contact the pharmacy. So the reason we've made this agreement is to ensure that the pharmacist has time to contact that patient and give them the required time for their consultation, whether that is in person or remotely. The next point is that we've agreed with pharmacies that once that referral has been received, they will make contact with the patient within 2 to 3 hours. So that's to ensure that we are, we're keeping on top of these referrals. They are minor illnesses and low acuity conditions, so a 2 to 3 hour time frame shouldn't be any problem for the patient to be waiting. But it is just worth noting to your patient that if they don't receive any contact from the pharmacy team within 2 to 3 hours, that they should make contact with the pharmacy. The next agreement that we've made is there's a 2:30 p.m. cut-off time. So any referrals that are received before 2:30 by any pharmacy will be picked up on the same day. Anything that's after 2:30 may be picked up the following day, but we do expect that all pharmacists should use their professional judgment to ensure that the patient can be kind of delayed till the next day if that is clinically appropriate. So there is just something to consider there when you're sending a referral, especially if it's a weekend or a bank holiday, just to be aware that that might take slightly longer for the pharmacy team to pick up if it is after that 2:30 p.m. cut-off time. But as a working group, we will be actively monitoring those referrals from when the pharmacies are receiving those referrals from general practice, and we'll also be looking out for any deviation from the processes that are agreed. So earlier on, Alison mentioned that there is potentially £20 million that could be saved if just 6% of all GP appointments were transferred to a community pharmacy. So somebody much cleverer than us has made some estimations that if we halved that and around 3% of those appointments were converted into a GP CPCS referral, that would result in the following target numbers of referrals per week. So as an example, if you have a practice list size of between 1,000 and 2,856 patients, you'd be expected to send about 1 referral per week. So we would suggest as a starting point that you'd start with those target number of referrals. And then when you feel maybe more confident and your team members are sending more and more, it'd be really beneficial to keep in communication with your local pharmacies, because unfortunately we don't have access to kind of the understanding of what each pharmacy team is experiencing, so what their capacity levels are like, what their staffing levels are like. So it's really, really important that you keep in contact with those colleagues so that you can start to increase those referrals, but also do it within the capacity of the pharmacy team. So we've just got a bit more information here of how you can embed the referrals into your normal processes, so into your triage process. So if we just start with the light blue boxes down the left-hand side of the screen, this is what would happen if you receive the request via telephone. So really, really straightforward. The request will be received by the receptionist or the care navigator, whoever picks up that call. And whilst you're on the phone, you would then assess the patient's reported symptoms against the red and green table that Alison went through earlier on, which shows which conditions are suitable to be referred by a GP CPCS. Once you have identified that it's suitable, you would then go onto the Patient Access Connect tool, and you will either use the Create Referral or Assess a Referral, as Alison went through earlier. And whilst you're on the phone, you'd then gain the consent from the patient to make that referral to the pharmacy team. So it'd all be done whilst on the phone with the patient. And that referral will then be sent electronically to the pharmacy team. As a lot of you, we are aware, use online triage systems, or you may receive your request via email. On the right-hand side in these purpley blue boxes, that's just showing the difference if we've kind of got that additional step of having to gain consent from the patient. So if that request was made online or via email, then you would assess the patient's reported symptoms using the table again. So whoever picks up those and kind of sorts through them would do that first and foremost. And then if it is identified that that patient is suitable for a referral, then they would then either send a text message to the patient. So things like Ask My GP have a facility to send a text to a patient asking kind of which pharmacy they'd like to be referred to, and it kind of states within the wording, which we can talk through with you if this is something that you use, that the patient consents. So if they respond to that text message that will be sent through that triage system, then they are giving consent for that referral to be made to the community pharmacy team, at which point the patient access connector will be used. That would then be sent to the pharmacy team in the electronic way, same as it would via telephone. For those of you who don't have that facility, what you can do is phone the patient. So there is just that little bit of an additional step. So you'll assess against the red and green table first and foremost, and then you would phone the patient to gain their consent to refer them to a community pharmacy, which is really important before we do so to make sure we understand where they want that referral to be sent to. Okay, so we're just going to take you through the escalation processes. So some of the possible outcomes that we looked at a minute ago in those bubbles were a possible escalation back to general practice or to another service. So we have made some agreements within Greater Manchester to ensure that, again, we've got consistency across practices and pharmacy teams. So the first option is for a non-urgent escalation process, and we may have already agreed this with your practice managers, or we may need to do so, but we will do that ahead of your go live and ensure that the details are communicated with pharmacy teams. So what we will ask for is either an email address or a phone number, dependent on your preference, for these to be communicated back to yourselves. So in this example, the pharmacist would identify that the patient requires a non-urgent GP appointment during the consultation. So what they would then do is they would make contact with the practice team. In most cases, practices are asking us to use an email for a non-urgent escalation, but that might be different depending on your practice. And it's really important that when that phone call's made, that we're not setting any expectations of the potential treatment or outcome to the patient. So what we will do is we will explain to the patient that they may need a referral back to their practice team, and then we'll arrange with the practice, either make the appointment over the phone if possible, or we will ask the practice team to pick up with the patient directly. The practice will then allocate an appointment to the patient and make contact with the patient directly, or we'll make the pharmacist aware of that when that appointment is, which will be communicated with the patient. Because the consultation has still taken place with the pharmacy team, the pharmacist will still complete farm outcomes, and that notification of the consultation will still be sent back to the practice team as well. The other option we have is if it's an urgent escalation. So in most cases, practice managers and practice teams have agreed that this will be communicated via telephone, more likely than not a direct line, which we are making sure that pharmacy teams are aware is only for the purpose of reporting back urgent escalations to general practice. So just along the top to the right hand side, it's showing what would happen. So the pharmacist would identify the patient needs an escalation back to the general practice team, and they would want to arrange an urgent in-hours appointment with the practice. So again, we're not going to set any expectation of the specific treatment or outcome. We will make the consultation record available to the general practice team, same as we would for the non-urgent or for a normal consultation outcome. And the practice team will then allocate an urgent same-day appointment to the patient. So there's just a note under here just to say if a patient contacts the practice to request an appointment following a referral, it should not be deemed as an urgent request by the practice, and the patient should be offered as a routine appointment. So that's just something to note for your reference. The other options are if it's out of hours. So of course, if it's severe and it's an urgent issue, then we can always call 999 or refer the patient to A&E. Again, that will be recorded on farm outcomes and you will have notification of that urgent escalation. And there's also the option to refer back into the NHS 111 healthcare professionals line as well. Either way, dependent on what that outcome is, that will always come back to the practice team, so you have knowledge of what's happened to that patient. So we're just going to show you a short video. Now, we're going to send the link out to everybody, which is a 30-minute virtual outcomes video, which you have access to, which gives a really good overview of this service and does provide some hints of tips of kind of what to do if a patient maybe doesn't want to be referred to a pharmacy team. So we've just pulled out a 5-minute clip, which goes through some of those hints and tips, which we think will be really beneficial. So I'm just going to play that for you now.
We have now looked at how the service itself works, and I hope that you feel confident that your patients will be cared for in the same manner that they would be if they saw a medical practitioner in your practice. I now want to look at how you are going to convince Mrs. Jones that being referred for a consultation with a community pharmacist is the most appropriate action for the symptoms that she has contacted you about today. How you say it to Mrs. Jones is really important, as are the phrases and words you use. We will look at 2 different ways that you can say the same thing. and I want you to think about what you've heard on each occasion and how did it make you feel. Don't worry about writing any of these down, as they are on the resources page. Example 1. Mrs. Jones, I have listened to your symptoms today, and I suggest we send you to a community pharmacy. What do you think that Mrs. Jones heard and thought? The feedback from GP practice teams that I have trained includes the following. I'm being fobbed off. I want to see a GP. They're not taking me seriously. Alternatively, let's look at example 2. Mrs. Jones, having listened to your symptoms, I am sending you for a personal consultation today with an NHS community pharmacist. If you can just let me know which pharmacy you would like to go to, I can make the official referral now. What do you think Mrs. Jones heard and thought in this case? The feedback from the GP practice teams I have trained includes some of the following. They're taking me seriously. I'm going to have a personal consultation. I must be special. I can talk to someone today. It's an NHS service. That means it must be okay. So, by adding a couple of additional words, you have sent a completely different message. The GP practice teams I have trained were also clear that you don't ask Mrs. Jones whether or not she wants to go and see the pharmacist, hence the use of the word sending. Finally, a thought to leave you with. If you told Mrs. Jones that you were sending her for an X-ray at the local urgent care centre, it is highly unlikely that she would argue with you, as you are sending her to the most appropriate place to care for her condition. Sending Mrs. Jones to a community pharmacist for her minor illness follows exactly the same principles. That is, you are sending her to a medical expert who can appropriately care for her. However, we know that Mrs. Jones may still offer some reasons why she still needs to see a GP. Let's now look at some of those reasons and your potential answers to them. A list of these is also included on the resources page on the right-hand side of this screen, so that you can print it off and have it next to each of your colleagues as a reminder. When Mrs. Jones says, "If I go to the pharmacist, I won't get an appointment today," the answer is, "Mrs. Jones, if the pharmacist believes you need an urgent appointment, they will contact us." Mrs. Jones says, "I have been to the pharmacy already and they couldn't help." Mrs. Jones, did you have a personal consultation with the pharmacist where they went through the medicines you are on, etc.? The pharmacist won't know what to do. Mrs. Jones, pharmacists are highly trained professionals with 4 to 5 years training and spend a high percentage of their time helping patients with symptoms such as yours. I am not going to pay for anything as I get my prescriptions free. Mrs. Jones, the pharmacist will clinically assess you and will discuss the most appropriate actions to help you, which may or may not include a product. Finally, remember you are not going to persuade every patient with a minor illness to have a referral to the pharmacist. There will be some patients where you know it's not going to happen, and I'm sure you know who I mean. However, if you can move even 75% of your patients, you have just freed up more capacity for your practice. We have nearly come to the end of this training, and the final thing I want to cover is the following question you may have. Our practice is already very good at navigating / signposting patients to other services, including advising people to go to a pharmacy. Why do we need an electronic referral when we can just tell people to go? There are a number of reasons why it is better that you use this service and do an electronic referral. 1. By sending an electronic referral, you are ensuring that the patient is clinically assessed by the highly trained pharmacist. 2. The outcome of the consultation and any product supplied will be sent back to your practice, ensuring that your practitioners have the most up-to-date information and that you know the patient actually did attend a pharmacy and didn't just say they did. And 3. If the patient requires a referral back to the practice, this will be formally handled, therefore safely managing risk across primary care. And finally, 4. The pharmacist will get paid for the consultation, whereas if you already refer the patient, they won't.
Brilliant. So I hope you'll agree that there's some really good hints and tips there. And as we said, we will share the link with you, which will be available within this presentation as well, which you can use to access the 30-minute video. We would recommend that all colleagues watch that full video before going live with referrals. It will really, really help. And as we say, that will be made available to you. So we're now going to move on to a Q&A session, which obviously we haven't got people here with us today, but what we have done is pull together some of the most commonly asked questions from the training sessions we've held so far, which we thought would be beneficial to run through with you today. So I'm just going to pass to Bev, who's going to go through those questions with us. Thanks, Bev.
Hello everybody, I hope you're enjoying today's session and it's hopefully very useful for yourselves. As Esther said, I'm going to go through a couple of questions which will be really useful for yourself. Alison, what about the patients who get free prescriptions? How does it work for them?
Brilliant question, thanks Bev. And we do get asked this one a lot. It's a common concern for general practice teams. So if somebody gets free prescriptions, if that patient is resident in an area that has the locally commissioned minor ailments scheme, so currently that is most localities in Greater Manchester except Bolton, and if that patient fits the eligibility criteria for the minor ailments scheme, which is currently HC2 certificates, income support, universal credit, and if their symptoms are covered by the minor ailments service formulary, then they can be treated under that service and receive a medicine supply free of charge. But if the patient isn't eligible for minor ailments, or if they're in a locality of Greater Manchester that doesn't have a commissioned minor ailments scheme, and if the pharmacist deems that a supply of a medicine over the counter is required, then the patient will be asked to purchase it. We understand that that might be a challenge in some areas, but actually in the pilot, they particularly looked at this aspect from in the evaluation, and it wasn't perceived as a significant issue. One of the other points to mention with this is that actually quite a lot of the time, the pharmacist may recommend products that the patient already has at home. So it may be something simple like paracetamol or ibuprofen, or it may be what's known as a homely remedy. So, for example, honey and lemon for a sore throat or a cold. So it may appear that this is an issue for you, but actually the evidence is showing us so far that it hasn't become a significant issue. Hope that answers the question, Bev.
Thank you very much, Alison. Esther, do patients have to pay to use this service?
Thanks, Bev. So just following on from what Alison's just said, so there is no charge for this service. If as an outcome of the consultation an over-the-counter medicine is required, then the patient will be asked to purchase it if they are not eligible under the eligibility criteria for the minor ailment scheme, and if their symptoms are not covered by the formulary. So they might need to be referred back to the general practice team if they need an NHS prescription for a medicine that can't be prescribed purchased over the counter. So where over-the-counter medicines are required, they are usually quite inexpensive, and the CCGs already have policies in place to reduce the prescribing of over-the-counter medicines where possible in line with national policy. So hopefully that will really help with patients accessing this service.
Thank you very much, Esther. Alison, what happens if the pharmacist cannot contact the patient?
Yeah, it's a difficult one, this, Bev. Unfortunately, there isn't an electronic message back to the GP. You'd think in the 2021, where we're in an all electronic service, that this would all be working in a very slick manner. But unfortunately, the system isn't set up to send messages back into general practice. And actually, in the service specification for the pharmacy, it doesn't require the pharmacy to inform the GP in that case if they haven't been able to contact the patient. But I would just like to point out that because referrals are for patients with minor illnesses or low acuity conditions, and if that patient is not contactable, that the pharmacy does have to attempt to make contact. If the patient is not contactable and the patient hasn't attempted to contact the pharmacy themselves nor presented elsewhere, then there is an assumption made that the issue is no longer problematic for the patient. We do see in some cases where this happens, the patient has actually self-presented elsewhere at another pharmacy. But it probably is one of the aspects of the service that maybe could do with a little bit of tweaking if the service gets reviewed at some point in the future.
Thank you very much, Alison. Thank you. Esther, back to yourself. I was wondering, are there any materials that can help promote this service to our patients so they're aware of what this service actually is?
Thanks, Bev. It is a really good question and one we get asked a lot. So no, there isn't, is the easy answer. So the specification does state that the service shouldn't be promoted directly to patients as it's considered as part of the standard triage process, in the same way that a patient would refer, the practice would refer a patient to the physiotherapist or to a specialist service. So within the PCN toolkit that we are going to be providing, and which is linked within this presentation, there is also some additional information which practices can use to kind of talk to patients. So it gives some clear lines on how to promote the service internally when speaking to those patients, but there is no promotional materials available.
Thank you very much, Esther. Alison, how does the practice decide in which pharmacy to send the referral to?
Thanks, Bev. Again, a really good question, and we do get asked this quite a lot. We did talk about it a little bit earlier in the presentation, and it's really important actually that the patient is sent to the pharmacy of their choice. So quite often practices might think that they will want to send the patient to the pharmacy that they have nominated via EPS for their prescriptions. And it may be the case that that's the pharmacy the patient wants to be referred to, but equally they may wish to be referred somewhere else because they want to go somewhere that's close to where they work or for another reason. So that's why we showed you that process about embedding this into your triage. So making sure that however you receive the calls in from your patients, that you are making contact with them to confirm which pharmacy it is that they want to be sent to. So that's really, really important. It does need to be the patient's choice as to which pharmacy they're being sent to.
Thank you very much, Alison. Esther, the staff on the reception have got used to signposting patients to the pharmacy to buy over-the-counter medications. For example, head lice solution, varicose treatment, ringworm, bedworm, etc. Will this continue to be the same, or should these patients be referred under the GP-CPS service?
Thanks, Bev. Hopefully some of this question was answered in the virtual outcomes video that we just showed, which is why is there a need for this referral? But really fair point. So I guess if the reception staff are comfortable that the patient's symptoms have been correctly diagnosed and that the patient doesn't need a clinical consultation with the pharmacist for any additional advice or support, then they can signpost the pharmacy without making a GP-CPCS referral. But it is just worth thinking about if there is a chance that patient's issue could be something other than what they think it is, or if the reception staff member or care navigator isn't fully confident in the diagnosis they've given, or they feel that the patient would benefit from a further consultation, a clinical consultation with the pharmacist, then we would recommend referring under GP-CPCS.
Thank you very much, Esther. They're just a few of the frequently asked questions, what are very important. But I'd like you all to remember that you can always email us, which our emails we'll send on to yourselves for any further questions. We'd be more than happy to answer. We'll always come across different questions, so please feel free to utilise ourselves, and we'd be more than happy to help you out there. Thank you.
Thanks so much, Bev. So although we're aware that you are watching this as a recording and you're not here with us today, we would really be grateful for your feedback. So there are just a few things that we would be grateful for you to have a think about. So what went well in today's session, maybe what could be improved for next time or for future events. And there's just a short MS form which we've put together, which obviously is linked within this slide, which if you could complete, we'd be really, really grateful. Anything that you can give us, positive or negative, we will take on board for the next events. There's also our working group email address just on here for you. So if you have got any further queries after today that maybe you've thought about upon reflection, you can get in touch with us and we will hopefully be able to support. Lastly, we've just got a number of resources here for your reference. So some really helpful documents and case studies here. So we've got the advanced service specification, which will be beneficial for both practice teams and pharmacies as well. There's the videos that we've referenced to in the training today, and some frequently asked questions for general practice teams as well. So if you do want to have a look through any of those, they're all linked here, and they will be included on our respective LPC websites as well. So that brings us to the end of our training session. So we thank you for joining us today and look forward to hearing your feedback. Thank you very much for joining us.
Thank you very much.
Thank you.
Thank you.